I'm Deb, I'm the manager at Deloraine House.
Can you tell us what's happening?
At the moment we're juggling so many balls in the air, waiting for government to get back on into working, to be sitting, and the turmoil that we've had leading up to that, with the election called literally at a very short notice. We were due to have our funding come in on the 1st of July, with everything being in recess, in caretaker mode. We're still waiting for that money to come through, which has meant that we've had to get there and find funds from other places to be able to pay wages.
Which government department does it come through?
Okay, we are funded through the Department of Premier and Cabinet. Until Cabinet sits, that's us. And of course Treasury is still in recess, so until they swear in a Cabinet and they actually sit and open Treasury, we're still trying to cover wages.
I have heard that maybe the number of days might be reduced in the meantime until...
We've had to reduce our days for a couple of reasons, funding being one, but also the fact that we are funded for 2 full-time workers 40 years ago, still funded for 2 full-time workers. And as we discussed earlier, it is, people came in 40 years ago for a nice, simple, and that's, we're not, no disrespect to community, nice simple things, that it was about getting an extra loaf of bread, or it's about getting a baby weighed by the child health nurse, or it was about just social interaction. Now we're not, we're dealing with high-end, high needs clients, complex situations. If we've only got many days, there's only 1 worker here with only 2 full-time workers. We spread that load across 7 of us, and we're all part-time, but many hours are here and days are here with 1 person here. It only takes 1 person to call in sick and somebody's alone. That's not safe for community, it's not safe for users of the house, it's not safe for staff.
Are you comfortable talking about circumstances that have been challenging for Deloraine House recently?
Deloraine's no different to any other town in Tasmania, or in fact Australia. The increase of drugs and alcohol dependency has increased. We see clients on a daily basis that have got drug and alcohol affected. And people, when they're in that space, are not in their normal mindset. We had a drug overdose happen here a couple of weeks ago. If there was only 1 staff member, that could have ended really badly, not just for the staff, but could have ended badly for the client if we couldn't help them. And we've got to make sure everybody else that's in the house at that time is also safe.
Can you talk a little bit about the ambulance and police response?
So staff had to deal with that situation, or a staff member dealt with that situation for an hour, just waiting for police and ambulance to get here. We have no police on town now. Ambulance are not allowed to come for any drug or incidents unless they've got police in attendance with them. So they had to wait till the police could come from wherever they were, and now the station's between Longford and Cressy, that's an hour away.
What happens from here?
What happens from here is, even though we've reduced hours, we've reduced days, we got together as a staff and we looked at what was our slowest day, what was our quietest day, and what was our quietest times. So we've decided we'd close Fridays, but to alleviate loss of hours, we've increased our hours over the other 4 days. So we're now open 9 till 4 instead of 10 till 4. So literally all we're losing is about 3 hours in a week, which is because community still need to be here. We understand that it is an inconvenience to community, but we have to also think about what's best for everyone across the board. So at the moment, lobbied really hard as an organisation and as a network with the 35 houses across the state pre-election. We asked for an increase to 5 FTE, which is full-time equivalent. That would, look, if we got 4, we knew we were asking for more than we were going to get. Unfortunately, we didn't get any. We were hoping for 4. 4 would be a huge difference to us. It means that there would always be at least 2 workers here, and we could open 5 days a week, and we could extend our hours even sometimes. Yeah.
How can the community help?
Community can help by, when they're talking to their local member, tell them what the house means to them. Tell them what having shorter hours or shorter days means. It means the craft group that meets on Fridays now meets on a different day. And that's not always convenient to them. Talk to them about what the benefits of community houses are. They know we're of a benefit. They know that we serve community. They know that because when we had the floods, we were the first place the local government and everybody else came to for assistance with the evacuation centres. But they don't know about us on the everyday. So I think if community can talk to their local member, tell them how much that we need to be here, that we've been here for 40 years, which in itself says that the need is here and the need's increased. I can give you an example for the 6 years I've been here. In 2019, we were putting through, on average, and remembering we were one of the only houses that stayed open during COVID, we were putting through, on average in the 2019-2020 financial year, about 300 to 320 people contacted a week. During the last financial year, with the 23-24 financial year, we put through over 1,500 contacts a week. That's a huge increase on the same money and the same amount of staff. And we can't do that. Burnout is a real thing, and as much as we like to do as much as we can, we have to be realistic too.
Can people in the community contribute funds, time or anything in that respect as
Wonderful question. And volunteers have decreased. We know since COVID that volunteers across the board have decreased. I'm of the older age group that's probably going to be the last group that's going to be able to volunteer when we retire. Many young people now, with the cost of living, it takes 2 wages, 2 incomes to be able to afford to live. People are time poor to be able to volunteer. We have just applied to become DGR, which is Donated Gift Recipients, and PBI, which is Public Beneficiary Institution. That'll mean that people, if they want to donate to us, can claim it back on their tax. So that'll be a really big incentive to have people donate. Become a member of the house. It's $12 for a year. It's not a huge amount, but as we did last week when we did what we can do for homelessness, $20 buys 4 meals. $20 provides 5 showers and 5 loads of laundry for somebody. So $12 might sound not much, but what we do with $12 or $22 for a family membership can be lots.
And how do they do that? On the website, or do they come in?
Can you either donate by just on the website? Membership forms are on the website. Just fill them in and donate that way. Or they can come in and have a chat. See what we do. You might actually find that's something we can offer you.